Good morning everyone, Chris from the Headache and Pain Management Centre here for your Friday, and we've got a little bit of a follow-up video this morning from our video on Wednesday about the Med-X machine. We've got heaps of emails that have come through since that day talking about the Med-X, and there was basically some comments regarding, hello there, good to see you, type in underneath and say hello. Basically just a couple of questions about the Med-X and are the results that I'm talking about actually accurate, and is it actually possible to get your back stronger after having back pain for such a long period of time. So just sort of really quick video this morning for your Friday about the results that the Med-X machine can get. And it's not just results that are coming from our clinic. We thought we'd actually give you the results more from the research here. So we've got an article here called 20 Years of Specific Isolated Lumbar Extension Research Review. So basically what these researchers did is they took a whole swathe of studies with clinics that are actually using this equipment to talk about actually the results that this equipment gets with low back pain, which is really, really stunning and a lot better than what you'd actually think with regards to, say, surgery or other types of exercise. So I'm just going to look through here to have a look at a couple of the really big benefits that we're talking about here on the paper. So the first one was actually a really good one where it said the largest study to date of the effects of specific lumbar extension exercise on low back pain, so that's the Med-X machine, talked about 895 patients at a 12-month follow-up, okay? So this is a really big study with a lot of people with a really big follow-up, which is great. So patients had tried an average of 6 other treatments, okay? So a lot of people as well that come into this clinic have seen 5, 6, 7, 10. I think the record is more like 25 people for their low back pain. So this is an average of 6. And 89% of them have failed a supervised exercise program. So really common. They've actually been to the gym, they've been and done their yoga and Pilates, and it just hasn't quite worked out for them. Now in this study it said that the treatment was continued until treatment was continued until the patient was pain-free or not making any additional gains in spinal function. So basically what that means is that they did the Med-X machine and they built their strength up as much as they possibly could until it plateaued off and wasn't sort of improving any further. So out of that, 76% of patients rated their results good or excellent at the end of their treatment block, which is a 12-week block. Okay, so 76%, that's 3 in 4, said it was good or excellent. And just remember that these patients had seen 6 other people about all that. And what the staggering thing is about this result is that 70% of them actually lasted 12 months without actually needing to go back to treatment. Okay, so that's a massive result, huge. Massive result. So when we're talking about surgery, for example, the success rate for surgery with back pain is much, much, much lower than that. Sometimes as low as 20%, and a lot of them actually fail, where they've actually, done all these sorts of things with their back. They've done the surgery and it's actually failed and the pain is still there. So what I'm saying here with this, the Med-X machine, is that you're actually getting strength into your back. The back pain is reducing off, and 3 in 4 people are lasting 12 months without needing to go back, which is just fantastic. I might actually just mention this extra bit here which is talking about spinal surgery, where another study was talking about spinal surgery could be prevented by lumbar extension exercise. And out of 46 patients who were initially recommended for surgery, that's 46, only 3 required surgery at the end of it. So 43 out of 46 that they thought needed surgery didn't need surgery after using the Med-X lumbar extension machine. So that's a massive result. So for anyone who's considering the next step in their low back pain, okay, so whether that's cortisone injections, whether that's discectomies, fusions, these sorts of things, it's really worth getting your back strength checked first, because a lot of the time the exercises for the back machine will actually take the pain away, because the pain itself is coming from a weakness in the muscles, and when those muscles are weak, the joints get stiff and tight, they get protective, and it means that the back pain gets even worse, and it means that you can't move. So really worth your consideration there with the Med-X machine. And look, what we've actually done is we've put together, I'm actually really happy, 2 things. Firstly, I'm really happy to send you the research there if you'd like to read it. And second, we've put together a booklet which sort of explains exactly the protocol that we use here at the Headache and Pain Management Centre for the Med-X machine. Now, if you're interested in that, you can type in Med-X, M-E-D-X, in the comments below, and we'll happily shoot that through, both the research and the booklet that we're talking about that gets the best results. So going from there. So yeah, just sort of dispel a few questions there in that video. The Med-X machine really does work. and there's a lot of patients that are getting really great results after getting a lot of stuff that's failing. Feel free to like, share, comment, and type in below MedX if you'd like that information, or anyone who's thinking about back surgery and perhaps isn't really keen on that and want to explore another route, because we're trying to get people off the operating table rather than people on it. So that's great. Hope you're having a great Friday, and I'll talk to you again soon. Thanks very much, and bye for now.